Hi everyone, we are Group 3 and we are presenting Hildegard Peplau's theory of interpersonal relations. Hi, my name is Hildegard Peplau. I am an American nurse theorist. I was born in Pennsylvania in 1909. I have a master's and doctoral degrees from Columbia University and I got my certification in psychoanalysis from William Allen White Institution of New York City. I specialized in psychiatric nursing. I was a professor and a faculty member of the College of Nursing at Rutgers University from 1954 to 1974. I am most known because of my development in theory of interpersonal relations, which will be discussed and applied in this presentation. My philosophies are influenced by other disciplines such as psychiatry, medicine, sociology, etc. I was able to distinguish each of these disciplines' roles in a person's life. My ideas were all drawn from my experience as a psychiatric nurse and based on Maslow's hierarchy of needs, Freud's psychoanalytical and Sullivan's interpersonal relations theory. Let's look at the major concepts of Peplau's theory of interpersonal relations. In her theory of interpersonal relations, Peplau emphasized that the nurse-patient relationship is the core in providing nursing care. The relationship creates engagement and connection between both parties. Peplau also added this type of professional relationship allows the nurse to incorporate her intellectual expertise, interpersonal and social skills when connecting with patients. Peplau's goal is for nurses to enhance their nursing skills and develop their potentials when establishing interpersonal relations with patients. Four components of Peplau's theory are person, environment, health and nursing. Person. A developing organism that tries to reduce anxiety caused by needs. Environment. Consists of existing forces outside of the person and put in the context of culture. Health. A word symbol that implies a forward movement of personality. Nursing. A significant therapeutic interpersonal process that functions cooperatively with another human process that makes health possible for individuals in communities. Peplau identifies 6 main roles for the nurse. Stranger. The nurse receives the patient in the same way the patient meets a stranger in other life situations. Teacher. The nurse imparts knowledge in reference to the needs or interests of the patient. Resource person. Providing specific information needed by the patient that helps the patient understand the problem or situation. Counselor. Helps the patient understand and integrate the meaning of current life situations, as well as provide guidance and encouragement in order to make changes. Surrogate. The nurse helps the patient clarify the domains of dependence, interdependence, and independence, and acts as an advocate for the patient. Leader. The nurse helps the patient take on maximum responsibility for meeting his or her treatment goals. Peplau identifies 4 sequential phases in the interpersonal relationship. Orientation. Identification. Exploitation. And resolution. Fundamental ideas underlie Peplau's theory of interpersonal relations. Nursing is defined as an interpersonal, therapeutic process that takes place when professionals, specifically educated to be nurses, engage in therapeutic relationships with people who are in need of health services. Psychiatric nurses are not just there to treat their patients' psychiatric problems. They are care providers who aim to communicate with patients actively, empathetically, and attentively. The nurse and the patient can interact. Patients are considered subjects and not objects of care. Nurse-patient relations are the center of all nursing care. The patient and the nurse mature as the result of their therapeutic interaction. Communication and interviewing skills are fundamental nursing tools. Nurses' self-understanding allows them to promote their clients' growth and avoid limiting their choices to those that nurses value.
Ms. Smith is a 35-year-old woman, who has recently had a baby boy, Ethan. She is in a common-law relationship with Mr. Kelly, the father of the child. Ms. Smith has been studying social sciences in university, and recently continued her studies with a master's degree, which are still in process. They have been together for 8 years, and they have an apartment in the city. Miss Smith has an older mother outside of the city, and Mr. Kelly's parents live in another country. Miss Smith was diagnosed with depression in her 20s, and recovered with therapy and medication. She was seeing an obstetrician during the pregnancy, and there was talk that she may want to see a therapist before delivery, but never got a referral in time. It was noted that she had been experiencing anxiety during the pregnancy, relating to the health of the baby and the fact that she was still in the middle of her studies. The delivery was long and complicated, due to a posterior position of the baby. Miss Smith stayed in the hospital for 3 days after delivery, where she and the baby were looked after and made sure that she had the knowledge and was strong enough to care for the baby. After discharge, the couple has come back for a few follow-up appointments. They talked about contacting a family doctor who would take care of the baby when the postnatal appointments had ended. Miss Smith looked tired, but seemed to love her baby. After 3 weeks, Miss Smith was brought to the emergency by Mr. Kelly. He is worried, because Miss Smith has not been eating or sleeping, has been extremely agitated and anxious, and extremely worried about the baby's health. The reason for bringing her to emergency was that she had started talking about someone trying to take her baby. Mr. Kelly had tried to assure her that no one would be coming, but Miss Smith wouldn't listen and said that they have set microphones in their apartment. Mr. Kelly came to the emergency with her and the baby, and she was admitted to the hospital with a diagnosis of postpartum psychosis. We will now look at the 4 phases of Peplau's theory of interpersonal relations in more detail and apply the theory into the scenario. The orientation phase. This phase defines the problem. It starts when the nurse meets the patient and the two are strangers. It is the assessment of the patient's health and situation. The nurse identifies themselves to the patient by name and professional status and states the purpose, nature and time available to the patient. The nurse obtains essential information about the patient through interview, history taking, assessment and any other needed methods. Nurse's attention is focused learning about and getting to know the patient.
Hi, Mrs. Smith. I'm going to be your nurse today. How are you? I'm scared. Why am I here? Is my baby safe? Someone's trying to hurt her. You are safe here, and your baby is safe. Is this your partner, Mr. Kelly? Yes. Is it okay if I talk to both of you? Yes. Are you sure there's no microphones recording us? No one is recording us. I'm going to take your vitals, review your history, and then we can talk some more and get to know each other. Okay. Please help me keep my baby safe and talk quietly in case they're listening.
Identification phase. During the identification phase, the nurse ensures that the patient is allowed to express emotions. The professional selects the appropriate assistance and a nursing care plan is developed based on the situation. The patient starts to feel capable of dealing with the problem. Feelings of helplessness and hopelessness are decreased. The patient starts to feel like they belong, and starts to feel stronger, working together with the provider. Postpartum psychosis is often treated at an inpatient center for at least a couple days, until there is no more risk of the mother harming themselves or the baby. The condition is temporary and most recover within a few weeks. The psychotic episode is treated with medications, such as antipsychotics, for example risperidone, and mood stabilizers, for example carbamazepine. If there is further treatment needed, electroconvulsive shock therapy, ECT, is often effective.
Patient goals are as follows. To have mental health restored and lessen worry and anxiety. That the psychosis symptoms have disappeared. To be connected to continuous mental health support such as a therapist, psychiatric nurse, etc. And to be able to return home and take care of her baby.
Nursing interventions in our case scenario. Firstly, the nurse needs to make sure that someone will take care of the baby while the patient is admitted. The nurse needs to find out if the father is able to do it, and if teaching such as information about baby formula is required. The patient's mother may be able to help. The nurse can contact a social worker if needed. Nursing diagnosis and the care plan. 1. Impaired social interaction. Assessing the effectiveness of medication, and monitor the psychosis symptoms. Avoid distractions, noises and crowds, and touching the patient. Acknowledge the patient's positive efforts. 2. Disturbed sensory perception. Monitor symptoms of anxiety, worry and irritability. Together with the patient, identify needs behind the episode, and evaluate options for meeting the needs. 3. Disturbed thought process. Allow the patient's feelings concerning the delusions, and try to understand the worries that are behind the patient's delusions from the patient's perspective. Explain all treatments to the patient, empowering the patient to cope with the situation. Encourage healthy practices such as a consistent schedule. Make precautions for everyone's safety. 4. Defensive coping. Non-judgmental and neutral care, honesty and transparency. Assessing for possible aggression. The use of plain language. 5. Interrupted family process. Determine each family member's knowledge of psychosis, and educate about warning indicators of relapse, and medication.
All of these psychosis nursing interventions work towards gaining trust and helping the patient to feel capable to deal with the issue. At this point, the patient does not have a sense of illness. The most pressing problem from the patient's perspective is that someone is going to take the baby. The nurse must assure the patient that the baby is well taken care of by the dad, and try to help ease the mother's anxiety about this. After the treatment has started working, and the patient understands that they are ill, they can truly start working towards healing from the mental illness. The identification phase, the nurse takes on the roles of resource person role, active leadership role, and surrogate role.
I am afraid that someone will take Ethan. They are listening to us all the time. Please help us.
I understand that you have that fear. Mr. Kelly will take care of Ethan and he will make sure nothing bad happens to him. It is best that you rest now and you'll be able to go back home soon. I know this is very difficult, but together we'll be able to get through this time. I will help you and always let you know what happens.
I want to be able to take care of my baby.
I will help you get to that goal.
Exploitation phase. Patient actively seeks professional help to solve their issue, feeling like an integral part of the therapeutic environment. They take full advantage of the therapeutic relationship at this phase. The nurse uses interviewing techniques to understand the underlying issues. The patient's independence may still fluctuate, and the nurse must be aware of that. At this point, the patient participates actively in the decision-making process. The nurse is supportive and provides guidance, empowering the patient to make informed decisions. The nurse should also support the patient in accessing all available resources as they work towards achieving their goals, which were established during the identification phase. In the case scenario, there is the implementation of the nursing plan, which involves taking action to meet the set goals. In this scenario, Ms. Smith first needs to understand that they are ill and in need of care, before the exploitation phase can be reached. There must be improvement in psychosis symptoms before this can happen. At the exploitation phase, Ms. Smith actively seeks and draws help. Ms. Smith initiates the work towards her goal and healing. The nurse supports Ms. Smith in achieving her goals.
I realized that I had an unbased fear of someone listening and trying to take my baby. I recognize that I have a mental illness that has to be treated so that I can return home. I will work towards reaching my goal with your help.
I notice that your illness has improved, and I assure you that this is a temporary illness which can be treated. We will need to work together to reach your goal.
Now let us see the resolution phase. In this phase, the patient's needs have been met by the collaborative efforts of the patient and the nurse. Termination of professional and therapeutic nurse-patient relationship. The termination can be difficult as a bond has been formed between nurse and the patient. The patient drifts away and breaks the bond, and a healthier emotional balance is demonstrated, and both become mature individuals. In this case scenario, discharge planning, which leads to termination of relationship. Client evaluation, determining if Ms. Smith has reached the previously laid goals, and if she is capable of going home safely. The patient decides together with the nurse what her new goals are after the discharge. At the time of discharge, Ms. Smith has learned to acknowledge deluded beliefs if they continue and demonstrates appropriate coping methods to reduce paranoid delusions. Ms. Smith has developed positive coping strategies to use in the future for anxiety and depression. There has been personal and professional social support identified for Ms. Smith in the community. Ms. Smith has a plan in place for continuous mental health support, mental health nurse, therapist, family doctor, etc. For Mr. Kelly has gained information about the illness, and contact information for additional support resources. He is aware of what the signs are if there is a relapse.
You have reached the goals that we determined together. What are your new goals, and how will you take care of your mental health at home?
I know where I can find help if I need it. I know what to do if I start getting anxious and fearful. I know that I have continuous mental health support appointments and will attend those. I am practicing coping strategies and try to have a consistent schedule.
I know who to contact if I notice any changes in Miss Smith's health. I will help her attend the appointments and to care for the baby. I will make sure she gets social support.
Conclusion. Peplau's theory of interpersonal relations is very patient-oriented and a helpful tool for the nurse with supporting the patient. The interpersonal relations theory focuses on empowering the patient and equips them for discharge. However, the fact that it is so patient-oriented was a challenge in our scenario as Ms. Smith was experiencing psychosis and needed medication and intervention before she was able to fully identify her needs and goals and take responsibility for them. A criticism of the theory is that the identification and exploitation phases overlap significantly, which is a bit confusing. Peplau acknowledged this limitation and later edited the theory and reduced it from 4 to 3 phases, with identification and exploitation being included within the working phase. Vogelsang, 2022. Another criticism is that the theory is linear and does not allow for movement back and forth between stages. Many patients in psychiatric care have relapses in their mental health and require readmission. This theory seems to imply wellness at the stage of resolution and does not allow for the often cyclical nature of psychiatric care. Thanks for watching.